So hello friends, welcome to my new video. So today in this video I'm going to discuss with you all about a very important topic that we should know, that is the blepharitis. Okay, so let's start. So before going to the discussion on blepharitis, first of all let we have a brief idea about blepharitis. So as we all know that blepharitis is a subacute or chronic inflammatory process of the lid margin, and as I mentioned that it's acute or chronic, so here chronic being more common form. um, so here if we tell about the classification of blepharitis, here blepharitis is mostly, there is the anatomical classification where it is two types, anterior and posterior, depending on at what location there is presence of those signs of blepharitis. So like in anterior it is due to infection, so these infections can be staphylococcal infection or infection due to herpes simplex virus or varicella zoster virus. So these viruses can lead to anterior blepharitis. Now if we tell about the posterior blepharitis, it is mainly due to the meibomian gland dysfunction, that meibomian gland which is responsible for the lipid layer secretion in the tear film, that prevent the evaporation of the tear film. So if this meibomian gland is not working properly and having some damage due to certain reason, as I already discussed about a dedicated video on this meibomian gland dysfunction, kindly take a look at that video to understand it properly. So due to that meibomian gland dysfunction, it gives chance to those pathogens or any like this to get infected. So this is a reason of blepharitis. So and also MGD, that is also known as meibomian gland dysfunction, is also responsible for dry eye symptom. So in both anterior and posterior, the symptoms that patient feel is quite similar, that I will discuss in my later slides. Okay, so here at first we can see this is a normal eye and this is a blepharitis affected eye. Okay, so this is a comparison. Okay, so here we can see a crusting is formation is there, and so this is due to infection. It can be staphylococcal infection or viral like herpes simplex or varicella zoster or protozoa demodex mite infection can be there, or due to MGD. Okay, so all these things, like which type of blepharitis is there, it is classified by proper examination with slit lamp, where you need to examine the anterior portion of the eyelid margin as well as posterior by everting, or the way you are comfortable in your slit lamp practicing. Okay, so this is a picture of anterior blepharitis, where you can see this is there is the infection. So normally in our face and in our eye many bacteria live, but if due to certain reason or due to some unhygienic condition that is happening to many of the people, so due to that unhygienic condition, if those microorganisms grow very much in the eyelid area, then it leads to certain infection. So if so it ultimately leading to acute blepharitis, and if this condition remain long period of time, then it is called as chronic blepharitis. Okay, so this is a posterior blepharitis, where you can see there is a few blocked orifices in the meibomian orifices. Here there is the blockage, blocked orifices are present, and also some crustings over there that you can see. So this is a posterior blepharitis. Okay, so here another thing, that etiology of blepharitis is also two. There is two types of, like acute and chronic. And acute, it is ulcerative and non-ulcerative. So ulcerative, it is mainly due to infection from, as I mentioned, those microorganisms like staphylococcus, herpes simplex, etc. So due to those infection, if there is a blepharitis is happening, then it is called as ulcerative. And non-ulcerative, actually it is due to allergic reactions such as atopic or seasonal allergic reaction, and due to those allergic reaction, if blepharitis is seen, then it is called as non-ulcerative. And chronic means if this condition leads to a long period of time, then it leads to certain changes in the eyelid margin also, that I will show the picture in these later slides. Okay, so first of all start with this first sign, like these are the crustings, where it is due to infection infection due to those microorganisms. So there is this types of crusting formation will be there in slit lamp photography. sorry, slit lamp examination. Okay, and there also you can see the blepharitis look like this, where there is crusting and flakes also present. So this is how you will see, or this is how blepharitis look like. Okay. Uh, Here, why I put this red eye, because due to this blepharitis, if it is due to anterior or sometime it's posterior, depending on its type. So due to that thing, there is a abnormal tear film also there, and due to that thing and due to that infection, eyes become red, and sometimes patient complain of like a pricking sensation, burning sensation like this, and also photophobia, and also crusting. These crustings, if there is a presence of crustings on the eyelash bases, then some people try to remove those crustings, and after removing, it leads to loss of eyelashes also. So these are some symptoms, like a burning sensation, as I already mentioned, irritation, tearing, photophobia, and redness of the eye. Okay, and the sign, the most common sign that you need to take a look while you are doing examination to a patient. Then you need to take a look at the proper eyelid examination in diffuse and then optic section, as you preferred. Here, first of all, crusting, flakes, and presence of telangiectasia and redness of the eyes. Okay, so telangiectasia means there is a abnormal vessels formation in the eyelid margin that will be a wavy pattern, like so appearance. So appearance of telangiectasia also, you need to take a look. Okay, so here. Now main thing is that how to treat this blepharitis condition. Okay, so here I put a picture where this girl is cleaning her eye lashes. So this is not only the treatment option. So here, mainly do warm compress, lead hygiene, and maintain lead hygiene. And if you are having blepharitis, then maintain lead hygiene. And if your patient is having blepharitis, then advise them to do warm compress regularly, maintain proper lead hygiene also, and do proper lead massage, and clean with baby shampoo. And if you need to prescribe some medication to the patient, then you can prescribe lubricating eye drops like Refresh Tear or Lubrex Progel, anything that you prefer. And then nowadays, azithromycin eye ointment are also very much getting popular in blepharitis treatment, where you need to advise the patient to apply a very little amount of that azithromycin ointment on the eyelid margin while they are going to sleep. So this is also sometime become very much effective treatment in blepharitis. Okay, so that's all, friends. Thanks for watching. Please don't forget to like my video and subscribe to my channel. Okay, so thank you so much.